spiritual sister, Minister Charlie, and I want to thank the Nigerian community tonight to invite me to this very special occasion, and it's just truly a blessing. And I don't want to be long because I like to be short, but one thing that I do know, I am honored to be a part of the Nigerian community, and I was a pastor of a Nigerian church, and I was ordained in a Nigerian church as a pastor. Wow! And the first Asian pastor in a Nigerian church here in New York for Social International Ministry. I will definitely give my donation, and I will do it privately, and I will see it through this organization. And I am honored to be a part of this organization in terms for the government level as a public relation for government because I work in government. Once again, thank you very much. We love you. May God bless you. And I enjoy this wonderful evening. And also I have a good friend of mine, my sister-in-law, my best friend, Lisa.
Thank you. Chifiroku, stay there. Don't use the bathroom. I'm coming. They go say, as I laugh, to all me,
I'm going to do my speech in vernacular because I went to night school and then it's Memorial Grammar School on Egypt. You can just show you about it. So let me do it in Igbo. On a broken. Nigeria. Nigeria last month on the 10th. Not that day before yesterday. I spent 30 days in Nigeria. Okay, sorry. Nigeria, not 30 days in Nigeria. Not one day now. You didn't know the so now because now I'm not going to marry far. I'm a bit of a so if you come down when I'm going to Mohammed Airport, the United Umuada. I'm a bit of that day, Lagos. Because now I'm going to bed to one. And the people on your bed, and I'm and I got that for you. I'm going to let the woman go to open us where they are. If I will not have attack, I don't know. Go to you. So I'm the United Umuada on behalf of myself, my wife, and family. And I'm for $501.
Hey, everybody down low. My chairman, and then all the high table members, distinguished ladies and gentlemen, go get chiri na were nasa omenala Igbo ka anyị nọ ya. Taa bụ ụbọchị akara aka eji si bịa dịka ụmụ anọte aka na Chineke mere ebere wee chabata mgbe na-atụrụ anya na ọtụtụ echego na mama mbịa bata mana Chineke na-efe edubata na-efe. So we thank God. Ana m ekenekwa my petrolo achịrị na oghere mọnụ. If you don't greet me now, then I don't want to be here. Did you see her greeting me? Yes. So we thank God for everything. And I use this opportunity also to thank Chief Asa Mugagori. Onye ndu anyị. Ife ahụ eboro gị, eziokwu iwu, eboro gị iwu karịrị gị. But na mberede gị jọmati gị. Wee gbaa mbọ, wee buru ibu anyị niile wee bunatara anyị. Ọha na-eze nkwanye ya. Osi n'ụlọ buru ya nata. Onye ọbụla anyị na-eleta nleta n'abalị ahụ. Maka na di bụ ife dị Igbo dị. O jide nwaanyị dekube ezi. So, matara ihe ndị widows na-edekube. So, I get connected. John, a good job. Never petrol nine. So, when I see not the moment behind it, they were $500.
Thank you. I wouldn't want to disturb you for more than 1 second. Let me grab the checks and run. Thank you very much. DJ! If you know this beautiful woman, if you don't want here, because they're going to be fine. Barrister, he may not be able to bring you down together. Don't spare them.
I'm going to support the United Nations with a bigger sum of
She didn't finish. She said she's giving right now 500 and then people put up.
I know this lady very well. They are women of integrity. They are women who put their mind and soul in everything they do. I had a long conversation with their patrons and I know my goals and aspirations. So that's why I'm supporting them. Please just take this amount and whatever else I can help you with, I will. I brought some passport screening that we can distribute to the guests for you, in their journey or tracking their health care. So that's part of my donation.
One of the most beautiful women tonight, her smile is intoxicating and sometimes confusing, but please recognize her tonight because I have the opportunity to MC this event.
Mma okeke iru ugegbe ọ ga-eche kasị ife niile na-ekwu mana ọ bụrụ na Igbo
Igbo nwa mpụtakwa dịka onwe ike onye a chekwa m na arụcha unu eji nwayọọ mepe so sụba n'Igbo ife anụma a na-eme tata na obi bụ mụta aṅụrị ndị oyibo si na ọhọlide eme ka ọ kwara ife mbụ na bie nya abịalụ m abịa ọ bịara ije ga-ana mana etu a m bịa mma nkịtị nwanne m emego nkie abụ m eji obere $60 wee sọpọtụ ọnya Enugu onwe ife ọbụla unu chọrọ fọmba anyị mmakọ ga-akọwasịcha ife niile abụ mbe biel oke ka a ga-achọ anyị achọ gị Enugu enwe ife ọbụla unu chọrọ mụnwa bụ mma okeke ga-eme ọdịru na ofe n'Enugu daalụ
Well, I don't have to introduce myself anymore. Most of you know me. I belong to so many organizations. Since Friday, I've been on the go. Party here. So, God, you know me very well. You know me very well. I will always support you and the 3 other women I know here, my charity and my slim fit. I will always support all of you. In anything you do, advice wise, you know when you give advice here, you pay, right? But she doesn't pay me consultation. I should be charging them for consultation. So, in my pocket, I had already written $100, $50 to give to God when dancing. So I will add all together, $150.
Thank you so much, y'all. Thank you, Victor. Now, please, members of the reserve table, go and get your food now. Because I'm opening up the floor and we have limited time for this food. Please, as I call you, head to the food area. There we go. Please, members of this table, can you go get your food now, please? Time is in essence, please. Please. Please, get your food, please. Thank you. DJ, put a background music not louder than 4 decibels. Please. Beautiful, Victor. You're the best. Keep it there. Keep it there. So I could hear myself. Come on, and the photographer, please serve them. Please.
When I stand up, I'm wide awake. When I sit down,
Oh, sorry.
Oh, no problem.
Once again, I need your divided attention. While you enjoy your meal, please give me the chance to relate with you from one ear while you're enjoying your food with the other ear. One of the key note speakers at this time will talk to us. Ladies and gentlemen, DJ, thank you. DJ, thank you.
Y'all know, that some people out there will just surround me, but I use to okay, not a time. I try, I meant two things at the same time. So, so after me that my voice is not that good, but forever. So Dr. Mrs. Ngozi Oguto has been a fixture in our community. Dr. Mrs. Oguto has her own practice and is doing things that not many people are doing from our community. So she has been someone who has cared for our community, both male and female, although today our focus is on women. Women are rise to your health. So today she's going to speak to us about women's issues and what we can be doing to ensure our health. And as they say, all wide in the family. If the woman in the family is healthy, there is a greater likelihood that the men in the family are also healthy. Because all wine and sister Jay with the checkup. Not that guy, not a go-get speech. You be there with one anyway. You know, but anyway, so without further ado, I introduce Dr. Mrs. Ngozi Oguto. Thank you.
I feel humble standing before you all this evening, and I'm not going to take a lot of your time because I know people are eager to do other things. I was at an event the other day and the speaker took so much of the time that we didn't have time to eat my drink and people were not happy. So I'm not going to let that happen. I have some people who know me as Ngozi Oji here. Please, it's the same person. Ngozi Oji, Ngozi Oji is the same person. I only try to make it easy for the Americans. Oji is only a 3-letter word, but the Oguto is longer, so I chose to stay with Oji. Charity, that is still up. It's the same person. 3 months ago, Evangelist Charity and I were having a discussion. She expressed to me her concerns about the recent deaths of a couple of our women. That morning, Charity was involved in planning a service for one of the ladies. She wondered if these were preventable deaths, that perhaps women were ignoring their health while putting their energies into other things, as we so often selflessly do. Women focus on their careers, their families, and communities. Are we doing enough for our health? Are we letting things slide in our lives that should not? Perhaps if we speak about these issues more often, it will help our cause in keeping it within our perspective or in our radar. Months later, after Charity and I's discussion, I was invited to speak on this matter, women's health. I don't know if this thing was born out of that discussion, but I certainly know women's health and wellness has been generating a lot of buzz recently. Maybe this is because this year is an unofficial year of women, with Hillary Clinton as the first female presidential nominee, and the celebration of women that surrounded the DNC convention. In fact, one of my friends told me a sorority hosted a workshop on women's health. So you should be not surprised that this evening we'll be discussing women's health. There's so much to talk about, but I really want to stress cardiovascular disease or heart disease. Because cardiovascular disease is the #1 killer of women. People think it's cancer, but cardiovascular disease kills 1 out of 3 women. I hope someday, with the help of United Umuada and Igbo, we can have a more interactive forum with some much needed discussion about this topic. I will be giving out some booklets, women's health and screening passports, to help you track your journey to wellness. It is a guide that helps you track important health measures, such as your body mass index, blood pressure, blood glucose level, along with recommended screenings and vaccinations. I would also be providing complimentary men's health and screening passports. We have to keep them healthy. We can't do anything without them. So even though we're talking about women's health, I'll give out the passport to men and women. I would like to begin with a few statistics. Cardiovascular disease is the #1 cause of death and disability for women in the US. 1 in 3 women die from cardiovascular disease and stroke each year. Heart disease and stroke disproportionately affect African American women, and they are more likely to die at an earlier age than women of other ethnicity. Another 90% of women have 1 or more risk factors for heart disease and stroke. Only 36% of African American women know that heart disease is their greatest health risk. We're always in denial. Women have a higher lifetime risk of stroke than men. 80% of heart disease and stroke may be prevented by lifestyle changes and education, such as healthy eating and weight management. Fewer women than men provide their first heart attack. Symptoms can be different in men versus women and can often be misunderstood by women and even some providers. Only about 50% of African American women are aware of the signs and symptoms of a heart attack. So for that reason, when it gets to signs and symptoms, I'm going to just spend a little time to talk about it. A patient of mine had stroke just about 2 weeks ago. Didn't even know he was having stroke. He had his mouth twisted to one side, but he said because he wasn't feeling pain, he didn't make anything of it. So it's important for us to know some of these signs and symptoms so we can take action. Women with cardiovascular disease generally are 10 years older than men. Younger women, however, less than 45, who develop heart disease usually have a worse prognosis than men, usually presenting with heart attack, congestive heart failure, or heart failure and sudden death. What are the symptoms of heart disease? Let me first of all tell you what heart disease is. Heart disease is a disease that affects the heart and the heart vessels, causing them to narrow, leading to heart attacks, chest pain, or stroke. Other types can affect the muscles of the heart, the valves which regulate blood flow, or the rhythm of the heart. There are different symptoms associated with the different types of heart disease. A condition called atherosclerosis causes narrowing of the blood vessels of the heart, affecting blood flow. The symptoms of heart disease in your blood vessel, that is the one we call atherosclerosis, where you have narrowing of the blood vessel, includes chest pain, dizziness, lightheadedness, pain in the neck, throat, pain in the throat, or pain in the back, pain in the arm, nausea, or pressure in the chest and discomfort. Sometimes you may have vomiting, you may have sweating, cold, clammy, or wet extremities. You can also have a racing heart or a slow heart. But women are likely to have trouble breathing, feeling weak, feeling much more tired than usual, and these are not the usual classical signs of heart disease or heart attack. Women also have the classical symptoms as well, which are chest pain, difficulty breathing, pain at rest, or pain when sleeping. That happens to women and is not the usual symptom of heart attack or heart disease. They also can have pain brought on by stress. And stress is a major cause of cardiovascular disease. And I'm glad somebody is going to talk to us about stress. They may not necessarily have pain on exertion, as men always typically do. Their chest pain may be sharp or burning, whereas in men, the chest pain is tightness or heaviness in the chest. A woman can also be asymptomatic, and when tested, the doctor finds out that they've already had a heart attack. This can also happen in men, and we call this silent MI. It's very prevalent in people with diabetes. Please, if you're having any of those symptoms or you've had any of those symptoms that I talked about, make an appointment and see your doctor. We also have another type of heart disease called arrhythmia, and it's an abnormal heartbeat. Your heart may beat too quickly, too slowly, or irregularly. The symptoms of heart disease caused by abnormal heartbeats or arrhythmias, I've named the different types of arrhythmias: atrial fibrillation, where you have an irregular heartbeat, or atrial flutter, or ventricular tachycardia, or ventricular fibrillation. These are all, the last one is the little one. The symptoms are fluttering in your chest, racing heartbeat, slow heartbeat, chest pain or discomfort, shortness of breath, lightheadedness, dizziness, fainting or near fainting. Another type of heart disease is cardiomyopathy, and this is thickening and stiffening of the heart muscle. The symptoms of heart disease caused by this weak heart, weak muscle, or cardiomyopathy are shortness of breath upon exertion, swelling of the feet, swelling of the ankles, feeling fatigue, irregular heartbeat, it could be fast, slow, dizziness, fainting. And the commonest one is the one we call dilated cardiomyopathy. We also have symptoms caused by the valvular problems. The valves are the channels or the gates that direct the blood flow through a particular channel. The symptoms of heart disease caused by valve problems are fatigue, shortness of breath, irregular beat, swelling of the feet, swelling of the ankles, chest pain, fainting. Please, again, if you experience any of these things, don't make excuses or be in denial. Speak to someone about it, your physician. What are the causes of cardiovascular disease? Atherosclerosis, the one that I talked about before, where you have buildup of fatty fats in the arteries, leading to thickening and stiffening of the arteries, and narrowing of the arteries, restricting blood flow to the organs. Atherosclerosis is the most common type of heart disease. The causes of heart arrhythmias can be inborn, where you have congenital heart problems. The causes of cardiomyopathy or enlarged heart could be the reduced blood flow to the heart. It can also be due to high blood pressure, which is a very common thing. And the commonest type of cardiomyopathy is dilated cardiomyopathy. You have enlargement of the heart muscle. KMCA met and said that blood pressures of 140/90 are acceptable. But we had a study that showed that when the blood pressures are even lower, you're better off. So we're aiming at 120/80 and not 140/90 or lower. Having diabetes is also a great risk factor, and it can worsen your high blood pressure, it can worsen the cholesterol level. Lack of exercise is linked to so many heart problems. Depression is associated with a major incidence of heart disease. Physicians have been told to screen every patient with, for depression. If you have depression, please listen to your physician, get treated. If you don't want medication, you can be counseled. And if you need medication, please take medication. If you are depressed and you have any chronic medical problem, chances are you are not going to be able to do well. You're not going to be stable. Whatever your medical problem is going to be out of control. Be it diabetes, be it hypertension or heart disease. There are some very serious complications that can occur as a result of heart disease. Heart failure is one of them, and it's the most common complication. And heart failure tends to occur a lot in women. Heart attack is also a complication, stroke is a complication, and aneurysm is also a complication. You can also have peripheral artery disease where you have pain or weakness or cramps in your legs when you walk, or sudden cardiac arrest. Sudden cardiac arrest have been found a lot in women who have phobic anxiety, especially if they have any other associated risk factors. Prevention. We are all in this together, please. Because I don't want people to think, okay, when I start talking about obesity, people will say, she's big, why is she talking about it? We are all in this together. Lifestyle changes are very important. Diet, exercise, weight loss. Keep your BMI less than 25. The booklet that I have distributed has all the goals. Keep your blood pressure less than 120/80. Control your diabetes if you're diabetic. Exercise at least 150 minutes of exercise a week is very important. But if you have established heart problems, speak to your doctor first before you start exercising. If you have medications, take your medication. If you have any issues with the medicine, please discuss with the physician. Many times patients are given medications, they will have side effects, they will keep the medication, they will not take it. They won't tell anybody until something happens. I've seen patients who had angioplasty and are supposed to be on blood thinners, but they read something about the blood thinner, or they heard something about the blood thinner, and they will leave the blood thinner. Treatment for heart disease, you could have medicines, you could have angioplasty, you could have stent or bypass, or in some cases, pacemakers. That's all I have. Thank you.
Thank you very much. Barrister Waji, can I move on? Oh, thank you, man. People call me after for permission. Thank you so much. Ladies and gentlemen, we are going back again. We have our kids ready for their display. We have other traditional dances that will entertain us tonight. But please, let's go back to what we are doing before I introduce dinner. I have a very good friend, an honorable gentleman, that drove 4 to 5 hours to grace this occasion. He's part of the managing director of Diamond Securities, and he came here because he's always supportive of whatever Igbo women do in the diaspora. Ladies and gentlemen, without forcing him to interrupt his meal, it's an honor to introduce to you Dr. Lucky Okamoke. Give it up, ladies and gentlemen.
Hi, Mr. Chairman. Good evening. Umuada, Igbo International, Ndị United, uniform so much. United women. In fact, in a video tomorrow, we're going to move from the computer. Igbo here and first lady.